First community conversation today, we are joined by Dr. Ryan Kellogg, a neurosurgeon with UVA Health. He's sitting down with Casey.
All right. Thank you so much, Steve. Thank you so much for being here with us today.
You're welcome. Thanks for inviting me.
Yeah, we are happy to have you. And today we're talking about brain aneurysms. For people who might not know, what are they? What causes them?
So a brain aneurysm or cerebral aneurysm is a weakening in one of the layers of the arterial wall for blood vessels that supply blood supply to the brain. And these weakenings with time can grow and essentially form an outpouching or a balloon, and this weakening in the artery can be a source of an aneurysm that ruptures or bleeds.
Yeah. And what would you say are some of the most common symptoms of an aneurysm?
So unfortunately, most aneurysms are asymptomatic, so a lot of people have them found when they get imaging for some other reason. So they don't cause any issues usually until they rupture. Rarely they can cause headaches, vision issues, other kind of problems that are more neurologic, but most people walk around with an aneurysm, don't even realize they have it.
Yeah, and that's what makes it kind of so scary. What can happen if one of these aneurysms goes undetected?
So if it goes undetected, right now we estimate maybe 2 to 3% of the population in the U.S. have a brain aneurysm, don't know it. So most people that have them live their life and usually don't have an issue, but there's a small portion of those people that have an aneurysm that's prone to rupture. And that's always our biggest concern, is that an aneurysm that goes undetected potentially ruptures and has a devastating consequence.
Right. What would you say are some of the treatment options available for people at UVA Health?
So management of aneurysms really breaks into 3 categories. The most common is observation. So again, a lot of aneurysms are small enough where they don't warrant treatment. Yeah. So we advise patients that you should undergo serial imaging. So yearly we might have them get a CAT scan or MRI to look at the blood vessels and make sure the aneurysm's not changing. Those that do require treatment, probably the most common option is endovascular treatment. And that's where we puncture into the wrist or the groin artery and use a small soft tube called a catheter, navigate it over a wire up to the arteries in the neck, get up to the brain artery, and then deliver a smaller catheter that then lets us treat the aneurysm from the inside.
Yeah.
So most of the treatments now are minimally invasive, but there are still some aneurysms that require traditional open surgery. And this is called microneurosurgery, and this is where we use a microscope to navigate down to the arteries on the brain, find the aneurysm, place a titanium clip across it, and seal it off.
Yeah.
So those are probably the 3 most common ways we recommend patients manage a brain aneurysm.
Yeah, it's amazing what you can do these days and how you can do it minimally invasively.
Certainly.
What would you say to people who might have more questions, maybe might be concerned that maybe they are having symptoms? What should they do?
Yeah, I would say if you either have a diagnosis of a brain aneurysm or are concerned, talk to your primary care doctor. They're usually pretty good at referring patients to a specialist that treats brain aneurysms. So if you've got imaging that shows you have a brain aneurysm and you're not sure what to do, most times the primary care doctor will refer someone to a specialist, and we are usually more than happy to answer patients' questions and help guide them through the management.
Awesome. Well, thank you so much for taking the time to be here today. We'll have you back soon.
All right.
And Steve, back over to you.